Hello everyone, I'm Jillian Ciriello, and today we are going to be reviewing therapeutic communication. By the end of this presentation, you should be able to explain the 3 phases of therapeutic communication, describe 4 factors that impact communication, apply techniques to enhance your therapeutic communication style, practice active listening, address areas of personal bias to become a better communicator, and avoid communication blocks for more effective dialogue with patients and colleagues. Therapeutic communication is purposeful communication that promotes trust and a positive working relationship to help patients progress toward goals. So it isn't simply a social interaction. It is a skill. It's part of your nursing tool set that you will use to help your patients achieve their best state of health. And there are 6 components of therapeutic communication to be mindful of in this process. And those are listening and observing. So as you're having a dialogue with your patients, you certainly want to listen to the words they're saying, but you also need to be observing and using your nursing judgment. Is what they're saying matching up with what you are assessing? Warmth. This is how you convey concern and build trust. In order for the patient to develop this helpful dialogue with you, they do need to trust you. Genuineness. Be yourself. This is very important. Therapeutic communication isn't just a list of tasks to follow. You will be finding your own style and being true to yourself in that. Attentiveness. You want to give your full attention to your patient's words and their concerns, their feelings. You want to be present with them, and we'll look more at what that means in active listening. Empathy. This is when you strive to understand the person's feelings, but remain professional. It's not sympathy. Sympathy is when you take on what the patient's feeling, and that would lead to burnout, and you wouldn't be an effective caregiver in that way. But you can empathize with what they're going through, respect what they're telling you, and come alongside them in their journey. And lastly, positive regard. And this is about respecting all patients. A patient may be different from you, and they will be different from you actually, and they may make different choices than what you personally would make. But all humans deserve respect and the best care that we can provide. And that is what we are called to in the role of a nurse. Active listening shows the patient that you're interested in what they're saying. So sit facing the patient whenever possible. Use an open posture, lean forward, establish eye contact. This is very important. So you can't be charting on your computer or taking notes while they're talking. You want to be looking at them and focusing on what they're saying. Relax and concentrate. Don't think about what you're going to say next. Just listen to what they're sharing with you. There are 3 phases of therapeutic communication. The orientation phase is when the nurse meets the patient for the first time. You want to come in and be open and friendly and clear. Introduce yourself. Let the patient know who you are, what your role is, and the goal of the orientation phase is to build trust. So you're showing the patient that you are a responsible and reliable professional, that you're going to keep their information appropriately confidential, and begin to build that relationship to help them work toward their goals. In the working phase, the nurse learns more about the patient's coping mechanisms and support systems, and this is when the nurse develops the care plan and implements that so the patient can begin working toward those goals. The termination phase concludes the working relationship. And at this time, the nurse should assess if the patient was helped. Was the care plan effective? And has the patient progressed toward those goals? There are a number of internal and external factors that affect communication. So first is congruence, and this means that nonverbal and verbal communication should match. So if you're telling a patient that you're interested in what they have to say, but then you're behind your computer, you're charting, you're not making eye contact, your words are not matching your actions, so that's an incongruity. The time and setting will also affect communication. You want a setting that's free from distractions, that's private, so you don't want visitors in the room while you're trying to have a discussion to build trust with your patient. Proxemics refers to personal space, and this is different for everyone. So assess how your patient's comfort level is. If they seem to be backing away from you, then take a step back. Give them space so that they don't feel like they need to be defending themselves, like they're in an uncomfortable posture. Physical disabilities, so hearing impairments, vision impairments can certainly affect communication. So you want to make sure that the patient has their hearing aids in and turned on, that they have their glasses. If you need some visual aids, anything that will help to improve the communication. And lastly, biases. And this is really important. I encourage each one of you to make a practice of just assessing any personal biases. And this is something not to do once in nursing school. This is something to do repeatedly throughout your nursing career, to assess, have any personal biases developed within me, and how do you address those? Well, with information, because what really fuels a bias is ignorance. So by learning more about a person or a community or a culture, you can break down any biases that you've noticed developing within yourself. One in particular that I really want to focus on in this course is any biases toward the older adult population. We see a lot of misinformation and misrepresentation in our society and in the media about this group of people, and we take care of older adults all the time. So it's important to understand what is normal and what is thriving in older age. And we're going to be talking about that a lot in this course, and that'll be a great opportunity just for all of us to really advocate for our patients. Silence. Are you comfortable with silence? Can you get comfortable with silence? This is an important part of therapeutic communication. Don't talk over your patients or rush them. You want to give them time if you're asking difficult questions or if they're trying to share personal feelings, especially, they may need just that time and that quiet to process. So getting comfortable with that will make you a more effective communicator. There are a number of communication blocks that will limit your ability to effectively develop a dialogue with your patients. Certainly you always want to be respectful, so any communication that's in any way belittling, stereotyping, disagreeing with the patient, or defensive in any way would not promote effective therapeutic communication. Also, changing the subject would convey that you're not interested in what they're saying, and that would shut them down as well. Asking closed-ended questions, so yes or no questions, that just ends the dialogue. It allows them just to say yes or no, and then where do you go from there? Why questions can put the patients in a defensive stance because it can feel like you're questioning their judgment. So you want to avoid those and ask more assessment-oriented questions to get that answer to that why that you're wondering about. Probing is asking unrelated information that is personal information that you don't need to know. It's just being nosy, and that's gonna make the patient curious about what your intentions are and put them on the defense so that they don't want to continue to share. And then giving advice and giving false reassurance. Again, it's not helpful, it's not You want to be honest, genuine, respectful, and giving false reassurance, just saying, oh, everything's going to be fine, when you don't really know that it is. That is not truly respecting the patient and what they're going through. So you want to be mindful of these different areas and avoid them. Some might be easier to fall into than others, asking why questions or closed-ended questions. Those might be some things that you're doing, and you can use clinical to start backing away from those communication blocks and seeing how you can open a more therapeutic dialogue. There are a number of techniques to enhance therapeutic communication. And this is a toolkit. This is not a list. You don't want to walk into a patient's room thinking, okay, first I'm going to validate the patient, then I'm going to clarify something they said, then I'm going to reflect. You don't want to check each one off the list. What developing your therapeutic communication style is all about is learning about each different technique, taking the time when you're at clinical, trying these techniques out, finding what is comfortable and genuine for you, expanding in areas that may be new to you, and also assessing your patient and learning which tool to choose that will most effectively help your patient. And clinical is excellent for this because this isn't something that you learn in one clinical day. This is something that you will continue to expand and grow throughout your time as a nurse, throughout your career. Now that you've learned a little bit about therapeutic communication, I'm going to ask you to apply this information in a role play exercise. So I will give you the scenario. You will pretend that I'm the patient and answer the questions out loud as if we were in a two-way video chat. I will then provide some guidance as to what an appropriate response would include. And you can feel free to contact me during my office hours or email me any questions, and we can discuss these role plays in more detail. But I just want you to get started applying this information and getting more comfortable with it so that for clinical this weekend, you'll be able to start using it. We're going to begin with the orientation phase of therapeutic communication. So I'd like you to imagine that I'm a patient and you've just walked into my hospital room and you're about to introduce yourself to me for the very first time. What do you say? An hour after lunch, you go in to check on your patient. His lunch tray is sitting there untouched, and he says, "I can't eat that." How do you respond? Now we're going to fast forward to the working phase of therapeutic communication. You've developed a care plan and your patient has started working toward their goals, but they've had some setbacks. When you go into the patient's room in the morning, the patient says, "This is all too hard. I don't even want to get out of bed today." How do you respond? Now that you have a little practice with therapeutic communication, make sure to put it to use in the clinical setting and begin to develop your own personal therapeutic communication style. Remember to use active listening, face the patient, and give them your full attention. Try out all the different techniques in your toolbox and be mindful of the communication blocks to avoid. Be intentional in the way you present and introduce yourself. The orientation phase is your chance to build trust and set the tone for your interactions, both with your patients and with your peers. I look forward to hearing about this process as we go through the semester together. Please feel free to contact me with any questions and have a great day.